625 cases of Puberphonia. So this is a great achievement for us. We are doing Umar therapy for Puberphonia and converting child voice, lady's voice into male voice. So this will happen in 90% of the cases in first day itself. But we have to give training for 5 days. Why? Because we have to habituate it. How we are habituating? That is a very interesting thing. Converting laryngeal to pharyngeal speech in Umar in 5 days training. It is a continuous practice in Siva ENT Hospital for Puberphonia. We are very successful. Even today, we are having 3 patients. That means they will be continuously coming, taking treatment, 5 days finish, they go, another boy will come. So it is a continuous process. To make them more interesting, we are giving only a speech training, mainly abdominal breathing. Near the mouth, we keep the hand and ask them to talk, bend the neck and talk. Push the wall and talk, lift the object and talk, lowering the larynx and talk, and with 2 fingers, pull the lower jaw and talk. These are the main thing we do. Depends upon the cases also. To make it more interesting, see, they are practicing from 11 o'clock to evening 6 o'clock continuously with little tea break and lunch break only. We give continuous practice. To make it more interesting, we train with Xbox technique and they sing with piano, artificial intelligent doll practice, audio visual practice with Koroko, practice with treadmill, practice with vibration, stage practice, mimic practice, virtual audience practice, above all group therapy. So it is a continuous process. We know fire of breathing is a fundamental for Umar training. What is fire of breathing? Abdominal breathing. Breathing we do daily, but it is divided into 3. Collar breathing, chest breathing, abdominal breathing. Few people will breathe only the collar level. Few people breathe the level of chest. Few people will breathe the level of abdomen. Abdominal breathing is good and great. It gives lot of strength to you. Even it is cure BP. Abdominal breathing, how to do? You can keep the hand in the abdomen. When you inhale, the abdomen should move forward. That you can appreciate with moving of the hand. So this practice is keep the hand in the abdomen and raise it. Very simple. So when you talk in the stage or talk with friends, you should do fire of breathing. So move the hand and talk. That is the basic principle. I hope all will be able to understand. This we give training. This should be a continuous process. So how to make it as a continuous process? Think for a while. When you breathe, the abdomen should move. For that, bend the neck and talk. This is the posture followed by all asthma patients. Asthma patient will sit, lean forward in a table and sleep. How a great treatment or therapy followed by asthma patient when they are sleeping. Even some children used to sit, lean forward and sleep. So this is the practice you should follow all Puberphonia boy. So this practice we do. Slowly, continuously, ever they will breathe only by abdomen. That is the good breathing exercise, a voice therapy for Puberphonia. So the basic principle is abdominal breathing. That's what I told you, collar breathing, chest breathing, abdominal breathing. The best and good breathing, that is the vital breathing, is abdominal breathing. So this is the training we give. Then make the sound vibration. How? Keep the hand near the face and talk. Or keep the hand, the fingers like a chungu and talk. Or keep both hands near the mouth and talk. Move the mouth and talk. That is the principle. You should not breathe through the chest or neck, abdominal breathing. You should speak with the mouth, not by the neck. Neck speech is for ladies. And oral speech, pharyngeal speech for male or Puberphonia treatment. Very simple. Our treatment is very simple. Anybody can follow. This we give training. How you get your training means isometric exercise. Push the wall, both hands, and talk. Pull the chair with the both hand and talk. Push both hands with the wall and talk. Make the chin depressed and open mouth and talk. Say namaste and talk. Or put pressure on both hands and talk. Or you do skipping and talk. So these are the procedures we can follow. You have to do it. It is not so simple, but you should do it. So fundamentally I have told, speak from the mouth or pharynx. Limit the larynx by holding the larynx, depress the larynx, add traction you apply to the neck. Very simple. This you can follow in the house. Very simply. And last one, very interesting, few Puberphonia boys never open the mouth and talk. Their voice is very feeble. You won't be able to appreciate their voice at all. Very feeble voice. So this is very important for puberphonia and stammering also. We should ask them to open the mouth and talk. How to ask them to open the mouth? Yes, with 2 fingers, you lower the jaw by placing the fingers in the incisor of the lower jaw and then talk. Ah, 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 ah. You will never get lady's voice. You will never get child voice by this maneuver. Very easily, these are the technique we have found out. We are telling it. Why I am emphasizing means this, I want this exercise, this 7 exercise, I want to publish in the next paper. There are some exercises for snoring, standard exercises. There are some standard exercises for vertigo. What are the standard exercises for puberphonia? That I am able to give. Once again, I want to repeat this small lecture. Number 1, abdominal breathing. Number 2, echo breathing. Maybe in the form of keeping the hand here or here, hand in the front of the mouth or hand like a mic or a tongue or say namaste with both hands and talk. Talk from the mouth. Hello, 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 hello. First, abdominal breathing. Second, echo breathing. Third, bend the neck and talk. Fourth is isometric exercise. Pull the wall or keep the cheek pressed and talk. Another thing is lift the object and talk. Next, stabilize the neck by neck traction. See, that is very important. We used to tell how to get a male voice. The larynx, the neck size should be increased, lowering of the larynx. Manually you can do it. You can apply traction, just like orthopedic surgeon, physiotherapist following, you can do it. The last one, important one, when sound is not coming, you lower the jaw, open the mouth, and they have to talk. Hello, hello. So these are the 7 exercises we follow after Umar therapy. First, you should be manipulated and uvula should get strength and patient should avoid talking from larynx. They should be initiated to talk only from the uvula, only from the nasopharynx, only from the pharynx, only from the mouth, only resonating in the nose. So that should be the first lesson for them. Then give this training, we will succeed. Happy! Today is Saturday, we have completed 1,625 cases of puberphonia. We pray God, the Almighty, the great happiness every day for us. Not only treating, we are giving new information to the medical fraternity. I hope all will take it. Thank you very much. We will meet next Saturday, the same time. Thank you, thank you, thank you.